Medical students who visit us often ask us what it is that makes us different here at Natividad. Natividad Medical Center is different in several ways. One is geography. We're in Salinas, birthplace of John Steinbeck, located on the spectacular central coast of California. Another is that we're the county hospital. And so in addition to a clear mission of education, we have a clear mission and sense of service here. Most of our patients are Latino agricultural workers, and they are absolutely wonderful people to learn from. In fact, I frequently tell residents that it's our patients, it's their stories, their lives, their issues, who are the real teachers here. The faculty support things, but really it's the patients where you're going to learn family medicine.
The coolest thing about being in residency is really the limitless opportunity to learn. There's nothing that we're not allowed to do. We have the full scope of practice as regular physicians. We do lumbar punctures here. We assist on C-sections. We deliver numerous babies. We get to see the full gamut of patients from birth all the way to the end of life. The patient population that we serve here at Natividad is primarily Spanish-speaking and underserved. They are also some of the most grateful and compliant patients that you could ask for.
Yes. And when are you going to follow up? On the 28th.
Perfect.
Okay. All right.
We have great attendings here, very knowledgeable. There's plenty of opportunities to learn. I chose Natividad in particular because I felt that it would afford me an opportunity to not only learn from the best, but also with and amongst the best people.
This is Alexander. This is a baby that was just born today. Making sure that nothing's abnormal. Look at his skin, his color, his tone. We have one of the most prolific nurseries here. We do have a lot of babies born here, and as a first-year intern at the hospital, I think I logged perhaps 60 vaginal deliveries, which is a lot for any family practice residency and for any residency in general. Typical day in the nursery consists of seeing all of the babies who are either just born or a day or two old, making sure that everything's going well with their feedings, that they're gaining weight, that moms have all of their questions answered, and in general making sure that everyone's healthy and well and getting them ready to go home, preparing them for parenthood and raising their newborn at home.
As a first year, you get introduced to the ICU. You have a 3-week rotation here, which is a good warm-up for second year. And you basically look after the patients with an attending supervision, but it's one-on-one, so you get a lot of learning. And obviously, if there's anything to do with the patients, you get to learn how to do it. You get to learn how to intubate, how to put in lines, how to manage patients with a huge variety of illnesses. We have patients who are extremely sick who come here. We are responsible for the patients from the time the attendings go home to the next morning. It's a community hospital and it's family practice based, so you don't have to compete with other residents to look after your patients. If you want to have fun, learn a lot, and be in a really supportive residency where you can kind of tailor-make your residency, this is a really good residency for you.
So today we're having fun. We're going out to the fields, as we do about every 3 weeks, with a resident to give health talks.
Okay. We really want our residents to get out of the hospital and out of clinics and out in the field. And part of it we set up ourselves, and part of it is for the residents to go out themselves and learn about the community.
Todos nosotros la comunidad hispana somos muy trabajadores. A veces no es fácil.
Today's topic was diabetes prevention. Diabetes is important because it affects the majority of the patients who are Latino or Hispanic.
You get to actually see the people at work, get to know your patients at their work site, get to understand better the working conditions that can influence their health, and get to do outreach such that we're doing more prevention and getting at the root causes of diseases.
It's a residency that is very resident focused, that the faculty are very dedicated to the residents, and that we have a passion. Those of us that are doing community medicine, we have a passion for what we do, and I think that makes a difference in terms of the kind of experience a resident has.
What I really like about this job is, once again, I am a resource for the patient that is in need. At any time, my patients that need help, I can try to be a service of them. I can provide answers or guidance. What I tell my patients all the time, as a doctor, I will guide you in any way feasible so that you can help yourself and make yourself better. I really love the community. Again, my family's from Oaxaca, and I really connect with the patients here. They have a true respect for the medical community. My mentors are excellent. The OB department accepted me kindly, and there's a great number of opportunities to do any number of cases. Come prepared, energetic, and that'll get you a long way. And if you're very interested in doing OB, this is the place to be.
We're hoping to attract those residents that would like to go out and work in rural areas and practice the full range of family medicine. And we expect residents to learn how to go from being taught to learning and looking for their learning on their own. And that is part of the maturation process during residency. There are really two selling points. One of which is the fact that we are a very strong obstetrical training location. And the other one is truly that we live in this magical paradise of Monterey County, where there's a lot of recreation. There's the aquarium, there's a lot of outdoor recreation, as well as a reasonable proximity to San Jose, San Francisco. We attract a tremendously diverse population, which obviously brings people from entirely different cultures together in a stressful and yet bonding experience of learning how to take care of people in a family medicine program.